Well, child mortality involves neonatal mortality and infant mortality, that is mortality under 5 years of age. Now, neonatal mortality in our country is very common, and the most important cause is the premature birth. And second, this premature birth leads to hypothermia and infection. Prematurity as such may lead to septicemia, and that may lead to premature, death of the baby in the form of neonatal death. And then comes to the infant mortality, that means death before the age of 5 years. The most important cause in our country is diarrhea and dehydration. Second important area is malnutrition in the form of undernutrition, and tuberculosis is a very important factor in our country. And third, which is very common nowadays, is the various forms of infection affecting the respiratory tract, causing bronchopneumonia or lobar pneumonia. So, pneumonia is another important cause of infant mortality at the age of 5 or less. Lot of things can be said as answer to this question, but I would like to brief it under 6 points. Number 1, as a 100% delivery, hospital delivery should be encouraged, and domiciliary or home delivery should be discouraged. Secondly, delivery should be done by trained personnel in the form of trained birth attendants, and they must use sterilized disposable kit while doing the delivery to prevent sepsis to the baby or neonate. Thirdly, emergency or adequate facilities must be there to transfer that mother, if necessary, to the nearest health center for tackling any complication. Then the child must have adequate nutrition. Most important is exclusive breastfeeding during first 6 months of the birth, and no other food like tin milk or preloaded or prelactial items must be given to the baby during the first 6 months, and after that homemade preparations may be given to the baby. Fourth, immunization schedule must be observed from the very first day of the birth till it is completed. Fifth, mother must know the symptoms of diarrhea and chest infection, which I have just told as an answer to the previous question, and they must know when to seek medical advice. And last but not the least is the spacing, that means gap between two children, and there must be adequate gap between two children so that the first child gets adequate attention and nutritive help from the family.